It's Fedi here. If you don't know who I am, I'm on a mission to help as many dentists as possible, help as many patients as possible. So, in turn, help dentists who help patients, making sure the patients, large number. So for that to be a large number, I need to help a large number of dentists. But anyways, for this video, I wanted to focus on offers, right? Because I've spoken to a lot of dentists who, it's not that they don't know how to create an offer, it's just, in a lot of cases, what they tend to do is just cut the prices, right? So I'll give an example with Invisalign because, well, it's changed how they do it now. Before Invisalign used to have like a specific territory where there would be, I can't remember the radius exactly. I'm just going to say 5 miles because I think it's 5 miles or 5 kilometers, but there'd only be 1 or 2 practices that have Invisalign treatments. But now you can have as many as you like, which creates quite a lot of competition because if someone were to walk into your practice and ask for an Invisalign treatment, and then here, let's say it was £3,500 or dollars, well, they'd say, well, I'm sorry, but Keith, right, on the other side of the road, he's offering them for 2,600. So the offer there is simply a price cut. But you can't keep cutting prices when things get competitive, right? That's not how an offer works. An offer, you just end up losing money. And the point of an offer is to just make it so irresistible to people that they can't say no. And of course, one part of that is to literally just make an offer where you just sell something really valuable for really cheap, but in turn that kind of diminishes its value in the long run, and especially emotional value for people who buy it. But my point is, in this video, I really want to focus on how to create a good, irresistible offer for certain treatments, and I'm going to kind of build a framework. So right now, I'm just going to do all the theory part, and I will go on my laptop and show you the whole framework itself and what it looks like and how you can break it down. But first, I want to make sure some basics are covered. So a big part of an offer, right, is to make sure that it speaks to the people that are wanting to buy, right? It speaks to your market. There's no point in having an offer that sounds irresistible to you, but that the person you're selling to just doesn't really care, right? Because of course, your irresistible offer would be the one that you make the most money with, or that you're able to help as many people as possible with. But unfortunately, the reality is most people aren't going to buy anything from you. They're not going to go forward with the treatments if there isn't a decent offer. And to be honest, there is a caveat to this. The caveat being that there are certain cases where you just don't really need an offer. If someone needs crowns sorted, right, or if someone needs periodontal work, then they don't really need to be convinced of that. They really just need it, right, for their oral health. So the main thing that I want you to focus on the offer, and you need to get in this mindset, is the offer needs to make you slightly nervous. And not nervous with price cuts, because that's a terrible idea, but nervous in the sense of, wow, am I giving too much away? Again, in value, not necessarily in money, or you losing money. Am I giving too much away? Like, you're going to be thinking, this, what if I don't deliver on this? These are the principles of a good offer, is that it should make you so uncomfortable that it's making your potential clients, your potential patients, just run to you. It doesn't matter how you feel, because it's going to convert so many strangers into paying patients just by it being so irresistible, right? And an example I can give for this is to have little bonuses, literally just a few bonuses. So let's say someone purchased a home teeth whitening kit. Home teeth whitening kits are usually £400 or so, but an irresistible offer with that would be a home teeth whitening kit. So you stack value alongside that. A teeth whitening kit, everything you need to maintain good oral health. So you could be like a little starter kit, if you will. So a way to floss, a toothbrush, toothpaste, and anything extra like that. So just little bonuses, right? And on top of that, which I think is really good, and it's really cool, not a lot are doing it, but I think we will do in the future, is to have some sort of video or a consultation available for them to not only know exactly step by step how to do the home teeth whitening, right, without having to look it up, is in you literally give them the video of, an example, or you send them an email saying, by the way, these are the videos I would watch, etc. right? So, and then alongside that, being able to offer them a consultation in 2 weeks or a month just to make sure everything has gone well. So, as you can see, the offer in that aspect is to make sure that their experience with teeth whitening is perfect. Because most people, right, who don't get it done professionally, who have home teeth whitening kits, it doesn't go that well, right? And there's loads of issues that they end up coming against and they don't really know how to fix them. So if you tell them as part of the offer, and I'll phrase it in like a really, like a pitch, right? So we offer home teeth whitening kit and we'll guide you A to Z, right? So don't worry, I'm going to say the person's name is Sarah. Don't worry, Sarah, we're going to send you videos, we're going to show you how to set everything up. We're going to make sure as well how you're able to maintain your teeth, and we've got little bonuses with that. So if you do have a toothbrush, chuck it away, we're getting you a new one. And we really want you, Sarah, to just have the best experience you can with teeth whitening. So we've got you your home kit. I've got you a few videos I'm going to send you by email. Make sure to watch them, just because they're going to be able to guide you on exactly what to do. And Sarah, do you want me to book you in for the consultation now, or would you rather call me up next week just so we can book it in? So it will just be for me to check that everything has gone well for you, and if there's an issue, we can sort it out straight away. So as you can see, right, Sarah got teeth whitening kit, all right, and you can make it more expensive because you're offering so much more, but she got a teeth whitening kit and she got so much more with it. She got peace of mind, which is a big thing, right? And she was able to get support. So something that we find is missing on a lot of the home teeth whitening kit stuff is that you get so much responsibility put on you, as in the person that's bought it. They get so much responsibility put on them that it gets kind of difficult to know exactly what to do. But it's a lot more alluring than getting a treatment done for it because it's a lot cheaper. So I'm going to break everything down really quickly on my laptop, that way you guys have got it visually. But the principle is, right, and to put it in one sentence, is offer something at the price that's 10 times less than its value. And that doesn't have to be monetary value. That can be sentimental value, that can be supportive value, etc. But if you offer something that's worth £1,000 and you sell it for 100, everybody's going to buy it, right? And again, I'm not saying you bought it for 1,000 and you're selling it for 100. That'd be stupid. But you can create value around loads of things. And if you built value around that home teeth whitening kit, the consultation being free, sending them all the videos and the support. Sure, if the home teeth whitening kit is 400, right? Sure, everything you're giving isn't worth 4,000 in total, but it's a lot closer to 4,000 than it is to 400. Well, maybe not exactly, but you get my point. Okay, so I'm going to break it down on the laptop real quick. Okay, got a 5-minute limit on myself just to make sure I don't waffle. But here's the main principle I wanted to speak about the offer, right? So if you look at it this way, you've got a client, excuse my terrible drawing, right? You've got a patient here, potential patient. So I'm going to write potential patient, PP. This is where they are, right? And this is where they want to be. Okay. So for this might be no pain. If they have, pain in their mouths, this might be extra confidence. Basically, wherever they want to be is exactly how you're going to take them is the offer. So all of this is offer plus service delivery. So your service, of course, they're not going to be able to get to having extra confidence if all you've done is give them a great offer but actually not fix their teeth. So this is the offer, right? And of course, I'll write really quickly the service. So the point of the offer is to make sure that this is as irresistible as possible. This whole thing isn't, look, people don't usually want to go through with something that is expensive, right? Or they don't have the confidence in themselves to follow through with certain things, especially like I mentioned, the home teeth whitening kit, but they have pain and they don't have confidence where they are here. And your service is going to fix that. But what's going to make it even more enticing for them
isn't just the pain being fixed or them having more confidence, it's the offer around that, right? So if I zoom out and go over here really quickly, the offer is going to do two things, right? It's going to, one, calm them down. By calm them down, I mean make sure that they don't feel like they're in risk, right? So it's going to be risk reversal. And then the second thing that the offer is going to do is make the journey, right, not just as easy as possible, but as informative as possible. Because one thing, and this is specifically for dentists, right? Because the one thing that a lot of people are missing is education in terms of how important their teeth are and how to take care of them, right? A lot of people are just oblivious to it. And that sounds a bit horrible, but they are. They don't know what to do exactly, and they don't know why it's important. Of course, they know they need to brush their teeth, and they know why that's important, but they don't know about gum health. They don't know about the risk of gum disease. They're not sure, how their habits affect and how they eat also affects their teeth and everything. So it's all about educating them. So on this case, the offer is also going to educate. And where are you coming from? I don't care. The thing is that's going to educate them about, as I mentioned, is how to go forward and how to continue being confident and being pain-free, right? Because everything links back to you solving these two problems, improving their health and improving their relationships. And your offer and service is what's going to do that. And your potential patient is going to be more enticed to go forward with this because of your offer, right? So I've only got a minute left, no rush, but I'm going to try and give an irresistible offer similar to the one that I gave earlier about the home teeth whitening kit. But this one is going to be about it being worth 100, but only being given for 10, for example, right? So I'm going to break it down really quickly, and I won't be on here, but I'll go back to the front-facing camera. But this aspect of the whole thing, this along, so this is the risk reversal part. I'll explain in a second, of course, and having them being educated. This is why consultations are going to be your biggest thing to just increase the value of your offer completely. Right, because consultations are huge. It's how you get people through the door, and it's how you keep people, and it's how you upsell them, it's how you take them across a different journey, right? So I'm going to break down the consultation really quickly and why the consultation is so important and how to build an offer around the consultation, because that's something I hear very often, really.
We're back here now. Okay, so the big thing about the consultation, and something I find a lot of people confused about, is whether or not to charge for a consultation, right? So free or paid? Do you make the consultation free and get as many people through the door, or do you make it paid to make sure your risk is reversed? To be honest, I like to have a middle ground, right? Because having the consultation free, it doesn't necessarily increase the amount of people that come through the door. It increases the amount of people that sign up for it, increases the amount of people that make the booking, but it doesn't actually increase the number of people that are walking in, right? So the bigger thing about that, right, is the quality of the people coming in as well. And I won't go into it in detail, but you understand, you've lived through it. But when you have people paid, you just simply have less people coming through the door, right? And I'm talking about paying full prices, in paying £80, so £60 to £100 usually consultations are. Well, they might go down to 40, but there isn't as much. There aren't that many barriers to that. But the way I like to frame a consultation fee is this. So look at it this way and help your patients or your potential patients see it this way as well. A consultation fee is actually just going to be a deposit for what we decide to do after your consultation. Once they show up to the consultation, and if you decide, you know what, they don't need any treatments, they just need to see the hygienist, etc., then you can tell them. Okay, in example, again, I'll use Sarah. Hey, Sarah. So I think going forward, all you need to do is just have a hygiene check every 2 months. Are you happy with that? Yeah, I'm happy with that. Okay, Sarah. So for your deposit that you've currently given for the consultation, would you rather I give that back to you now, or would you rather put it forward for your next meeting with the hygienist? Sarah will say, well, she'll say whatever she says, but she'll possibly say, yeah, no, sure, I'll put it forward, for the hygienist. And what you've done there is not only given Sarah the option, right, but you've also made sure that when Sarah comes in, she's already committed to seeing the hygienist again. I'm not going to go dive deep into that because I'm going to make a separate video on how to upsell and how to sell to patients without being a salesperson, right? With just being a dentist, because that's what you are at the end of the day. But in this scenario, right, you haven't, with Sarah coming in, you've guaranteed, one, that she's going to come in because she knows she's got a deposit, right? She wants to get the deposit. She has to either go in or get treatment later on. So not only have you enticed Sarah to come in, but you've also made sure that you're not risking anything. Okay. And the big thing about this, as I was mentioning, is that it makes sure that you have, obviously it's going to be less, but you have the people coming in through the door from your consultation being free with the quality of people who have already paid for the consultation. Because the people who are walking through the door, in this case, know that it's an investment. They're already committed, right? They've paid a deposit for it. So they know they're not going to get the deposit back if they don't show up. So first of all, you've basically guaranteed them showing up. Secondly, they're they're really open-minded about the fact that they could get a consultation again, or they could go forward with the treatment, go to the hygienist, the therapist, etc. All because they've put down a deposit. So what I'm saying is, don't go for a free consultation unless it's part of your offer for a free consultation for a specific treatment, right? As in a free consultation for, let's see, implants, right? Because that's if someone goes in for a consultation implants, they're basically guaranteed to get the implant if they need it. So then you can have a free consultation. That's absolutely fine because the value of you upselling them as well is a lot higher. But I'm talking just about an initial consultation with no potential treatment being aligned to it. The fact that you're making it free, it just decreases the, sentimental value. It decreases the value in the market itself with the consultation, because if you can just have a free consultation all the time, then, you're actually being helped. But if there's a deposit to it, you've made sure that the person feels like they've got a commitment to it and that you've got commitment to them, that you've already thought about the solution for them. So that's the way I'd build an offer around the consultation. And I know that offers can be quite scary, because if you feel like you're giving too much, you feel like you're losing. But the more you give, the more you get, right? The more you're able to give to your patients, the more they'll come to you again. You give them all the value you can on one specific treatment and they feel cared for, they're going to tell their mum, their sister, right, and their dad to come to you now, right? It's really simple in the sense that an offer needs to be irresistible, not to you, but to your potential patients. Because your potential patients, they're going to be the ones paying you, right? Just because the offer makes you feel good, you can get 10 sales with a really bad offer, right? You can get 10 patients with a really, really bad offer for them and make way less than having an offer that scares you, right? But you get 100 patients through the door. Or even if you don't, help all of them, as in get them on the treatment, you've had 100 people walk through the door. They've got you in mind. So I want you to really think about what the offer for your specific treatment can be. And I'll leave it at that, to be honest, in this video. So if you do struggle with offer creation, but most importantly, if you can take on 100 or so patients in the next 60 to 90 days, then feel free to press the link in the description for basically to work with me and my team. And the link, honestly, it's not a free guide. It's not anything really that is just of value straight away. It's just a video of me explaining how we can help and how we can basically guarantee there's 100 extra patients in the next 60, 90 days. But you're not obliged to press it. I just wanted to be open with you that it's there and that it is me trying to sell you something. So feel free to press it. If not, I'm not bothered at all. But to really, really hone into the idea that an offer needs to be irresistible, right? you should 100% make sure that the risk is reversed for your patients and they're being educated, because that's something that 99% of other dentists aren't doing, and you're not part of that 99% because you're watching this video and you're awesome. And if you did like this video, pop me a thumbs up. There's a button below that says that you liked it, and subscribe if you want more videos like this. And please, please, please leave me a comment if you want me to do a video specifically on an offer for a treatment, right? If there's a specific offer that you want me to create and break down for, let's say, implants or anything like that, then let me know and I will make a video on it as soon as possible. So yeah, thank you so much for watching. If you're still here, have a lovely, lovely rest of the week. Have a lovely weekend if it's a weekend, and take care.